It's an excellent question. Yesterday, in collaboration with my friend and fellow whangareian, Dr. Shane Reti, the Minister of Health, our government's announced $604 million extra money to buy medicines for New Zealanders over 4 years. This has been described as a game changer, and as in a country that has underinvested in medicines and treatments for far too long, it most certainly is. And Pharmac advise that this kind of money will help up to 175,000 people with medicines they wouldn't have otherwise had. 54 medicines, 26 of them aimed at cancer. That, Mr. Speaker, is a real change in our approach to healthcare in New Zealand.
Supplementary. Is he confident that Pharmac will be able to continue delivering improved access to medicines?
Mr. Speaker, I have spoken with the Chief Executive of Pharmac, and they accept that making sure that this huge uplift in funding is spent well to get value for money for all New Zealand patients is a challenge, and they have been allocated additional money in the range of $2 to $3 million a year to help them with this enormous procurement task of more medicines for Kiwi patients. However, this is what Pharmac are good at. They are an entity filled with people, skills in finance and pharmacology, and negotiating to get the best possible deal for Kiwi patients, and I'm very confident that's what they will do with these additional funds.
Supplementary. Why is it important that the Pharmac model is used to deliver new medicines?
Mr. Speaker, as I've said, Pharmac is filled with people with, I think, extraordinary ability, and I'm very proud to be the Minister responsible for this Crown entity. They have people with the skills and abilities. They know the pharmaceutical market, they know the developing technology, they know how to negotiate, and they know what value for money looks like. They are also an entity that is on a growth curve, improving its listening to patient voice, improving its agility and dexterity at delivering and funding medicines faster as the government works through MedSafe to consent them faster. For all of those reasons, I think it's an excellent entity and it's going to do a very good job at delivering these extra medicines for Kiwi patients.
Supplementary. What else will he be doing to improve access to medicine?
Well, Mr. Speaker, we are reforming MedSafe and the way that it consents new medicines. In particular, putting in place the rule of two, where a pharmaceutical or treatment that is consented in two other peer countries must be consented in New Zealand within 30 days of application to MedSafe. We have already ensured that medicines which are being consented with MedSafe can begin consenting for funding with Pharmac simultaneously, saving time getting medicines for market so they can start making New Zealanders well more quickly. This is the kind of thinking and innovation that is required in order to get better outcomes for the patient and may actually save the taxpayer money elsewhere in the healthcare system, and by allowing New Zealanders to return to work and live more active lives, which is good for the taxpayer and good for them.